I'll open. Dr. Bloom, were you going to say something or
somebody has questions? Laura.
Go for it, please. This is y'all's call.
I don't have to call them out.
Okay. Can you hear me?
Yes.
Okay. So I did one treatment with Dr. Bloom. I have numerous issues, but my overriding issue is that I've had UTIs for literally 5 years now. I mean, literally overlapping. I'm not even done with a course of antibiotics, and I have a new UTI. I've been on 3 antibiotics most recently at the same time and still getting UTIs while on 3 antibiotics. My husband and I have been doing a tremendous amount of research, about how devastating being on long-term antibiotics is. And, I probably have no good bacteria left in my body at this point. But I've been really trying to take a lot of probiotics to mitigate that a little bit. My question is, after the treatment a couple of weeks ago, I went off all of my antibiotics. I had about a week that I felt the best I have felt in 5 years.
That's what I was going to say.
But I'm back to having a UTI again. It only lasted a week. I guess my question kind of is, I also have interstitial cystitis. So when I have a UTI, it's like having a double bladder infection. It's very difficult for me to tolerate. And so it's extremely tempting to want to go back on the antibiotics. I guess I just wanted a little feedback on, should I just try to stay off them, push the probiotics and get through the second treatment, or is it okay to go back on the antibiotics? I just kind of wanted some feedback on what direction to go.
Well, this is I'm not giving you medical advice, right?
Yeah.
This is I was getting ready to say that the first thing, until you mentioned it, that typically we're finding that the antibiotics if you keep taking them, and then you just said it, you get off of them and all of a sudden you get better. It's because you probably don't need them, at least right now. I'm not saying that you won't need them in the future for a more targeted approach, but right now your body it sounds like it's stirred something up, and you said that you got off the antibiotics and it's the best you felt in a while. Now it's come back. This sounds like to me that, again, kind of like the epilepsy scenario, you've woken the beast. This sounds like an ivermectin, high-dose vitamin C scenario where you've now moved everything into the bloodstream, and now, which is causing the problem. A lot of times it's bug and parasite related. And you're clearing the terrain. I like how Dr. Denny says clearing the terrain. I would say ozone too. So these sounds like a perfect scenario where you've got things on the run, and it's been kicked out of their home. Mm-hmm. And now you kind of keep everything in the bloodstream by the high dose vitamin C. So it prevents or discourages anything from diving back in the tissues. The ivermectin is obviously just going to start laying waste to anything in the bloodstream. And then the ozone is a good treatment, obviously, for making that happen as well. And obviously, I think that your intuition about the probiotics is very sound, because what we've seen with people's gut results and data that have nothing but bad bacteria in their gut, and they're nothing but just problems after problems, kind of like what you're discussing, is after a treatment, they get their bacteria data back, and it's like there's no bacteria in there. And I'm like, well, at least there's no bad. So mm-hmm. now is the time to start putting the good in. But if you continue the antibiotics, then you're back in the cycle again.
Right.
So okay. I would say get with the provider, and I know the 2 guys, and I think Marina, they got the vitamin C, the ozone, and at least like the tool belt to depend. I don't know where you are to do that.
Okay. All right. Thank you. I appreciate your insight.
Sure. And to give you some hope, we see interstitial cystitis all the time. I can send you video after video of severe cases, and this knocks it down.
Okay. Thank you.
I suppose there is one example that the sequencing, I guess doing treatments in the right sequence is really important. Because
Yes.
we've done ozone therapy already, and it didn't work, and now we do the true dose. We see a significant shift, and now would be a good time to do the ozone and vitamin C, etc.
Can I add something? Can
Yes.
you hear me?
Yes, this is
Yes.
this. Please
Okay.
add something.
Okay. My husband's the one that got the true dose, is getting the true dose treatment, and he has Parkinson's and he had a stroke, but for years I've had bladder infections, and I actually had a hysterectomy and a bladder repair, and then it was not too long, well, maybe about a year after that, I started to really get a lot of bladder infections, and so then I had another surgery to lift the bladder, and that definitely helped. I didn't have a bladder infection for a year, and but then they came back, and so I found a supplement, knock on wood, that it's been about 2 years now that I've been taking it. It's kind of like been a miracle to help me with the bladder infections. If you want the name of it, I can give it to you. I think it might change the urine, what word do I want to use? The pH, yeah. But I mean, I've tried all kinds of stuff like baking soda, and I mean, I was on chronic antibiotics, and my immune system's down because I have tumors on my adrenal glands, so I have subclinical Cushing syndrome. So that can even add to the reason why I have gotten so many bladder infections. But if you want the information on what I take, I can give it to you.
I would appreciate that. Thank you.
Please put it in the chat if you don't mind.
Sure.
That's great. Thank you.
Mm-hmm.